Hello YouTube, this is Ray at Rucker and I wanted to do a video about what is dissociative identity disorder, how is it caused, and how is it treated. First, I'm going to start off with what is dissociation. Dissociation is a disconnection between memory, feelings, the body, the mind. Imagine you're driving down the road and you don't remember how you got somewhere. That is mild dissociation. Dissociative identity disorder is when you have two or more distinct identity or personality states that recurrently take control of a person's behavior. And they each have their own way of relating to the world. And they have their own feelings, emotions, behaviors, thoughts, perceptions. Dissociative identity disorder is caused by severe childhood trauma or abuse. This can include physical, sexual, mental, emotional, ritual, and spiritual abuse. DID is treated with psychotherapy. That is the mainstay of treatment for the disorder. Medications are used to treat concurrent symptoms such as depression and anxiety. So how many people actually have DID? DID affects up to 3% of the general population. It is more common than people first thought. DID affects up to 5% of psychiatric inpatients. According to some studies. What is my experience with DID? I first knew I had alters when I was 5 years old. I knew they weren't imaginary friends when they didn't go away when I was 10 years old. I knew something was really wrong. I've been telling doctors for years about the people in my head, and they just won't believe me. So I'm going to keep telling them about the people in my head until they believe me and I get the official diagnosis of DID. I have 36 alters with various different ages, names, abilities, skills, different tones of voice. Some even have different accents. The only reason I know all this is because I've been told by other people who have witnessed my alters coming out. And so that is my experience with DID. Medications I take are Geodon for mood stabilization, Boost Par for anxiety, melatonin for sleep, Remeron for sleep and depression, Prozac for depression, and a few others that I can't remember. Some common myths about dissociative identity disorder. It is like schizophrenia. Schizophrenia and DID are two totally different disorders. Schizophrenia is a psychotic disorder, and DID is a dissociative disorder. Schizophrenia means you can't tell reality from fantasy. DID means you have more than one personality state. It is not known as split personality disorder. There is no such thing as split personality disorder. The word schizophrenia has a meaning of split mind. That means you can't tell reality from fantasy. So how is DID treated? DID is treated with psychotherapy, sometimes hypnosis therapy, EMDR, which is eye movement desensitization and desensitization and reprocessing therapy, which integrates trauma memories into everyday life. That is just a little bit about what DID is, how it is caused, how it is treated, and a few myths about it. Thanks for watching. Bye-bye.